Neurosurgery is a rapidly evolving field that is constantly pushing the boundaries. The recent advancements in neurosurgery have made this field less invasive, more precise, and more effective, resulting in better outcome of the patients. Hi, this is Dr. Lakshmi, and you're watching Yashoda Hospital, the health obsession, where all your health-related queries are answered here. So let's discuss and know more about recent advancement in the field of neurosurgery in our today's episode. Joining our episode today is Dr. Ayyadurai, Senior Consultant Neurosurgeon from Yashoda Hospitals, Secunderabad. Welcome to the program, Doctor.
Yeah, thank you.
So, Doctor, in the recent years, there has been significant evolution in the field of neurosurgery. So, to begin with, can you elaborate on some of the notable innovations that we have witnessed?
So, neurosurgery, as such, like it's a big ocean. For the past 1 decade also, it has gone several developments, inclusive of various techniques, surgical methods, and becoming keyhole perspectives. Brain tumors were thought to be very complex 10 years ago, which is not now, because of the advanced techniques and the gadgets which we have to do the procedures with highly increased safety precautions. Even the tumors involving the most complex areas, like which we call it as eloquent areas, which means the areas of movement of your opposite side of the limbs or the speech or even the memory, can be excised safely. These are achievable with the help of high-end microscopes, navigation systems, intraoperative monitoring, and techniques to do the awake surgeries. That means keeping the patients awake during the surgeries, keep interacting with them all through the surgery, so that you know whether you are reaching the speech area or your motor area, which is responsible for your movement of the opposite side.
So, Doctor, you've mentioned about awake surgery. So, what exactly do we mean by awake surgery, and how does it significantly change the outcome of the patient?
Awake surgery means you keep the patient awake. We don't give anesthesia. At the beginning of the surgery, we give the blocks of the scalp. That means you make the whole of this cranium numb, so that the patient does not feel the pain. But we keep them awake while doing the craniotomy. While removing the bone, we keep them comfortable by giving slight sedation. A big amount of cooperation is required along with our neuroanesthetists. But when we are on the brain, when we reach the tumor, we map. We call it as a brain mapping. When we map, we identify, we electrically stimulate the brain surfaces, and we see the response of the patient. If it is on the speech area, the patient will have a speech arrest. By that, we understand that we have reached the speech area, and then we are going to be more careful or not damage that part of the brain. So when we do the awake surgeries near to the speech area, our excision rates are better. If your excision rates are going to be better, your patient's outcome or longevity of the living is also going to be better. Even it is achievable in the bad malignant tumors also.
I think that's a notable advancement that we have seen in neurosurgery. So, Doctor, you've mentioned about eloquent area. So, what exactly do we mean by eloquent areas, and how do we operate with them?
Eloquent areas are either the areas which involve your speech functions or the areas which involve your motor functions. That means your movements of one side of the limbs. Your left side brain is responsible for your speech and the movement of the right side. So they all are located in such a complex way. Now we will have to identify them when we do surgeries on the tumors which involving the eloquent areas.
So I'm sure neurosurgery is considered to be very complex, considering it is operated on one of the most important structure, that is the brain. So how do we operate on these structures to minimize the damage, Doctor?
So again, the same awake surgeries, we use neuronavigation. Neuronavigation is something like we get to know where exactly or on which part of the brain, by using the navigation. And by mapping, stimulating on the eloquent areas of the brain, we understand that we have reached the important area of the brain, which is which is responsible for your speech function or the motor function. While doing the mapping, by identifying the speech area, we not only identify the speech area, but then we avoid damaging them, or we would be able to excise maximum amount of the tumor by keeping the eloquent areas safely. So by achieving the maximum excision of the tumors, we are improving the outcome of the patient also. The malignant tumors, maximal excision, it is directly proportional to the outcome of the tumors. We know that malignant tumors, they are going to require further additional adjuvant therapy like radiation therapy or chemotherapy. The response to these radiation therapy and chemotherapy are going to be the best, provide the best outcome when we excise it maximally.
So modern technologies have significantly changed the outcome of brain tumor surgery, and intraoperative MRI is one of them. So what is the role of intraoperative MRI, and how do you think that it has significantly changed the patient outcome?
It makes a significant difference in the outcome. Having an intraoperative MRI, it's not an easy setup. In fact, I feel lucky to be working in such a unit where I have the intraoperative MRI, which is going to help my patient's outcomes go to better. That means when I finish a tumor, when I know that when I can't make out that if I had removed the tumor completely, I close the wound and then I take the patient directly from the operative room into the MRI, do the imaging, and then find out if I had completely removed the tumor. If I had not, then I bring the patient back to the table and continue finishing up the excision of the remaining part of the tumor. It goes very well with the gliomas, particularly low-grade gliomas, high-grade gliomas, where the complete excision matters in the outcome. Same way, it helps in excising excision of the pituitary adenomas or craniopharyngiomas, which we do the surgery through the nose. Sometimes the brain falls over the tumors and then we won't be able to identify that we are leaving behind the tumor. In such circumstances, you take the patient to the MRI intraoperatively without bringing them out of the anesthesia. You identify, and in the same anesthesia itself, before doing the final reconstruction, we remove the tumor and then you achieve great outcomes.
So I'm sure that is saving a lot of time for the patient as well, and also the surgeon is able to diagnose, monitor and treat the tumor simultaneously.
Exactly. They don't have to, then the next day you do the MRI, you are confused whether you are going to take the patient to the next day or to the operation theatre, or you end up leaving behind some tumor, compromising on the outcome, and then you think that okay, the radiation therapy can take care of it. But when you are able to excise it by doing the intraoperative MRI completely, they don't have to undergo another therapy or another surgery.
So doctor, with these advancements that we have seen in neurosurgery, how do you think that is benefiting the patient, especially if we have to talk about recovery time, which is the most important part for the patient?
So imagine a patient who is in an IT job, who has a tumor sitting next to his motor cortex, which is responsible for the movement in the right side. We do a tractography, which will tell us about the tract orientation, which is meant for his movement on the right side, and we analyze that in the navigation images. With the help of the navigation, we identify where exactly the tumor is sitting, where exactly the motor cortex is there. Pre-operatively itself, we planned how are we going to approach this. So once when we approach, with the help of intraoperative monitoring, we identify the motor cortex additionally along with the navigation help, so that increases the safety double-fold. And by doing the excision, keeping the motor cortex safely, the patient is going to wake up without having any additional deficit. This will reduce the hospital stay significantly, and the patient can get back to his work as early as possible.
So before we wrap this episode, doctor, is there any message that you would like to share with our viewers out there?
Do not fear anything involving the brain. Do not fear brain tumor. We have all the personnel who is trained. We have all the equipments, and particularly to highlight, we have intraoperative MRI, which is probably in Hyderabad, we are the only unit we have that. Please do not fear brain tumor anymore. You can go back home safely as the way you are coming into us.
I think that's wonderful, and thank you, Doctor, for enlightening us on the topic of brain surgery and its recent advancements. It was wonderful having you here on the episode today.
It's a pleasure of being here, and then I was able to share my little bit of information to the public, so that they feel more confident in undergoing the any brain ailment surgeries.
So that concludes our today's episode. We hope this episode was enlightening and informative on the topic recent advancements in neurosurgery, and do join us the next week as well. Until then, take care and stay healthy. Thank you.